So the exposome is seen through the Planetary Health Framework. And the reason why I chose this title is that our university, Nagasaki University, is now promoting the planetary health as the first in the university, among the university in Japan. And we are doing this planetary health framework for maybe 3 years or something. And first, I think that very small people knows about this planetary health, I assume that. But anyway, I will talk about this. And so I don't want to spend a lot of time for this one, and all of you are aware of this kind of the crisis, starting from the climate change and the pollution and the ecosystem crisis. Also that we have a huge pandemic recently, and also we have the food crisis still. And the important point is all of these are originated in our activity. So we used the environment. Here, and we utilize the land, and also we utilize the energy, and we utilize the biomass. And as a result of this, then our resource, or our nature and our resource is in danger. And almost 25 years ago, the one Nobel Prize awardee, Paul Crutzen, proposed the word Anthropocene. Although this wording has been recently rejected by the geologists, by voting, but anyway, the importance of the thinking in the framework of the Anthropocene remains. So as a result, maybe some of you may know about this, and this has been proposed by the Swedish climatologist and Rockström and another person, and almost 15 years back. And they termed this planetary boundaries. And they suggested, including the climate change, in total 9 regions are in danger. 9 regions of the subsystem of the Earth is in danger. So starting from climate change, biosphere, and fresh water, and atmosphere, these kind of things. And what they proposed was within this green circle, we are safe. But if our activity exceeds this green circle, then we have make the nature in danger. So this goes on planetary boundaries. So we have 9 boundaries. So this is providing the very important considerations for the whole global sustainability. And but for this conference, important point is this planetary boundaries, although this is a very central notion for the environmental scientists, but it didn't consider the human health and welfare so much. I think that they mentioned about that, but their main concern is subsystem of the Earth. So to tackle with these, the SDGs has been, of course, proposed by UN. But when we look about these 17 goals, we found many human-oriented goals, but some goals are mainly concerned the nature. So actually, these human-oriented goals and the nature-oriented goals may be going opposite way if you don't care about the whole picture. So there can be, we can say, the intrinsic trade-off among the SDG goals. This is a very important point. And also recently, it has been discussed between the climate scientists and also the biologists, and it is found that the climate-oriented actions and the biodiversity-oriented actions also sometimes have a conflict. So we need to take care of this kind of conflicts very carefully. So against this background, the planetary health has been born. And this is a structuralized SDGs, and on the top 2 rings, that these are the economy and the society. So this red circle concerned for the human society and the human health, welfare, and this one is mainly concerning the nature or ecosystem. So the aim of the planetary health is get these 3 rings together. Think about the relationship among these 3 rings, and also among the issues within one ring. So this is the very basic framework of the planetary health. So in the planetary health, in the original publication in the Lancet, it is said that planetary health refers to the health of the planet and the health of human and civilization, and the important point is they are interdependent. So maybe to fulfill or to pursue the planetary health, that we need to think about the planet, and also we need to think about the future generation, not only for the child, grandson, but that we need to think about the 5 or 6 generations in the future. And also the systemic thinking is fairly recommended. So probably many of you are familiar with lot of health fields. So compared to the public and global health, the planetary health, one feature of the planetary health is it has an ecological view. So it tries to locate the human or human society within the ecological context. So this is the last paper which has been published in the 2015. And the important point is they mentioned the 3 pillars for the planetary health, and planetary boundaries, SDGs, and environmental health. And the planetary boundaries is one of the very important pillar, and which is, I think, related with the ecosystem, exposome. So I will concentrate on this aspect. By the way, the currently planetary health, the community has been grown very big, and it says the Planetary Health Alliance is located in the Secretariat is located in the Johns Hopkins University, and member organization exceed 400 and over the 70 countries. And this year we have a meeting in Kuala Lumpur, and at that time there are more than 1,000 people are there, and also they are coming from over the 60 countries. And at that conference, we adopted a roadmap and action plan to pursue the planetary health idea. So here I would like to briefly compare the exposome and the planetary health. And before doing that, I would like to clarify the definition of the word here. And both planetary health and exposure is a concept or conceptual definition. And many people in their paper talks about planetary exposome as like this, and also planetary health as I just already introduced like this. So although the definition is very conceptual, but the actual way of using this term is very different. And I think many times exposome is meaning the exposome-related studies or exposome-related research. Likewise, planetary health just means the planetary health studies and the planetary health-related research. So these are some of the features I just picked up from the recent reviews and from the eyes of the planetary health. And regarding the outcomes, the exposome tried to covering the wide range of the health outcomes. So starting from the site-specific or disease-specific interest to the more broad perspective, including development and aging, which is a topic of this conference. And also regarding the exposure, it widened its scope. And I believe it started with concern on the chemicals and mixtures. But recently, I'm not so sure it is recently or not, but anyway, and it tried to cover the physical or social factors. And sometimes trying to capture the holistic environment, like built environment effect or relocation effect. So the third point is emphasis is on the mechanisms of the effects. I put the relative means compared to the planetary health community, that this community has a more emphasis on the mechanism. And finally, the advanced statistical method has been developed. So these are what I just picked up from the recent reviews. And the framework of the exposome and the planetary health are tabulated here, and both are primarily concerning the relationship between the environment and the human, of course. So that they share the common features, of course, but they have some difference. And these are the differences that I would like to emphasize. And in terms of priority, Exposome has a priority to understand the relationship between the environment and the disease or maybe health. And as opposed to the planetary health, which emphasize the sustainability. And I don't say no one working in the exposome community is thinking about the sustainability, but I think that if we compare these two concepts, the planetary health put more emphasis on the sustainability. Then approach is in case of exposome, it rather unidirectional from environment to the human society. And the planetary health is both bidirectional. So as a consequence, that we are more action oriented. And both are, sorry, I skipped one row, and both are holistic, as already mentioned by someone in the opening remarks. But exposome sometimes use this word unbiased, and the planetary health is not reached to that point. And the impact is, was, of course, concerned about the human and human society, but planetary health, we paid attention to the ecosystem. And time frame, mainly exposome is concerning the whole life of the individuals. And the planetary health is successive generations, and we emphasize the prediction side. Spatial scale also, of course, concern the local, but in case of the planetary health, it has some importance in the global scale impact. And finally, very important point is the exposome has a very deep interest in biological mechanisms. And it is, has a link with AOP, adverse outcome pathways, and also the multi-omics, which is also mentioned by among the opening remarks. And as opposed to this, the biological or mechanistic concern, the planetary health is physical, social mechanism is important, and also the ecological mechanism is important, which I will tell later. So the planetary boundaries, one of the topic is planetary boundary has, are there any planetary boundary for the chemicals? So in other words, are chemicals threatening the sustainability or not? And actually this tabulation shows that among the many environmental risks, including the tobacco or the infectious disease, big infectious disease, alcohol use, malnutrition, and the road accident. On the top of this, the total pollution. So still, the total pollution causes a huge impact on the human's life. And among the total pollution, the air pollution has a very big proportion of this. So still, the chemical pollution is very important in considering the human health. And of course, the planetary boundaries take care or consider this very important. So among these nine fields, the novel entities, this actually means the chemical exposures, is one of these 9 fields. And in addition to that, you may notice that many other fields like biosphere integrity, or that is fresh water, and also the atmospheric aerosol or ozone depletion, these are all related with the chemical exposure to something. But the important point is when you define the planetary boundaries, you need to identify the control variables and its boundary variable. And this control variable should be feasible to find, relevant to the effect, and holistic. So in case of the novel entities, which means the chemical exposures, in the beginning, when they proposed these planetary boundaries in 2009, they didn't identify anything. So they put just a question mark. So regarding the control variables, the climate, for example, taking the climate change as an example, climate change, the control variables two are identified. The one is atmospheric CO2 concentration and also anthropogenic radiative force. And they have each the boundary values, and probably the upper one is famous, and 350 ppm CO2 or CO2 equivalent greenhouse gas concentration is the boundaries of the climate change. And the current situation already exceeds these boundaries. In case of the novel entities, which is the chemical explosion, one group is trying to identify what is a control variables. And this group, I think they are Swedish, and they just propose an impact pathway. Impact pathway means from production to the environmental impact. So they just classified the process into the 6 steps, and from the production or extraction of the resources to the Earth system effects. Just note that this is effects on the Earth system, not human society function. Anyway, they try to identify the control variable among these variables. But actually, they couldn't identify the single variable for the planetary boundary for chemicals. And instead, they suggested combining 2 or more variables is appropriate. But thinking about these, the increase, huge and rapid increase in the chemical production within a very short time period, they suggested that the ability to produce and manufacture and release these chemicals by humans is far exceeding our ability to control and manage and evaluate these chemicals. So what they conclude was we have already surpassed the planetary boundary for chemicals. So that's their conclusion. And but still we need to identify the manipulative control variants using impact pathway model. So that was their conclusion. So actually, one paper published last year, the group who proposed the planetary boundaries, they adopted this control variable. So they say the percentage of the filtered chemicals released to the environment without adequate safety testing. And they propose the other planetary boundary, 0. So what they mean is any synthetic chemicals used and released into the environment must be adequately tested for the safety. So I think that you cannot straightforwardly agree with this kind of conclusion because it's very impossible. But actually, it has been adopted tentatively. So that I think that this planetary boundary for chemicals is premature and need to have the manipulable ones. And I think maybe the exposome community can contribute to this. So out of 9 fields, including novel entities, the 6 are already surpassing the planetary boundaries, and this is the situation of our Earth now. And the exposome can inform the planetary health or sustainability in several ways. And as I already mentioned, the planetary boundaries are only thinking about the Earth subsystems, not directly, not primarily on the human system or human health. But recently, the last year, there was a publication regarding the advanced type of the planetary boundaries in which they termed the Earth system boundaries. And in this Earth system boundaries, they also consider the human society and health. So I think that maybe using this framework, the exposome can contribute to the planetary boundary setting. So as I already mentioned, the exposome has a very strength in the unbiased nature and also the close connection with the biological mechanisms. But on the other hand, exposome doesn't talk too much about the sustainability, also the global scale issues and also the ecological framework. But the exposome can contribute to this kind of the studies, and this is showing the having more green areas in your vicinity or in your residence. These people have less mortality, and this is a very simple conclusion from this study, but it has huge study in the context of the epidemiology. But the mechanism is totally unknown. So maybe exposome information, including LP and Proteomics, may help to elucidate the mechanism, and by this, it can lead to the effective countermeasure implementation. And these are the so-called core benefits. So something, if you do something good for the environment, it's automatically good for the health. So you can find these examples in the energy, agriculture, buildings, and industry, transport, HFS solutions like this. But I think that most of the case that we don't know the mechanism. So maybe the exposome may evaluate the impacts of the environmental actions on the human exposome. And finally, in the planetary health, from the environmental change to the human health, we think the three major pathways is important. And of course, this is an action on the human, and the environmental changes is brought. And various environmental changes cause the good impact on the human health in various ways. The first one is the direct effects. The second and third one is the indirect effects. And the third one is more remote effects. And in the context of the planetary health, we think that these two sides, second and third pathways, are also important. And I think the exposome community may be thinking about this direct way. And so maybe if exposome community can, exposome structure can be accommodating these other routes, maybe it will be very informative to the planetary health or sustainability. So actually, this is just summarizing what I say. From the view of the planetary health, exposome is a very attractive approach for planetary health, and it's for its comprehensiveness and unbiased nature. And importantly, the explicit link with the biological and the toxicological pathways. And these are almost lacking from the planetary health or planetary boundary thinking. And second, the exposome may provide a basis for establishing planetary boundary or a system boundary, as I already showed, for chemicals. And maybe the exposome can propose some composite exposure score or something, and as planetary boundaries for the chemicals. And on the other hand, links between human and the ecosystem, for my eyes, is not so much focused in the exposome studies. So in the conclusion, the responsivity and the flexibility of the structure of the exposome to accommodate the predictions on the climate change and biodiversity, or the interaction with climate change and biodiversity might be considered. That's my conclusion. Thank you so much.